Welcome to PSY 318, Study Session 4, Developmental Disorders. Introduction. The essential feature of developmental disorders in the acquisition of cognitive language, motor or social skills. The course of developmental disorder tends to be chronic when signs of the disorder persist into adult life. However, in many mild cases, adaptation or full recovery may occur, DSM-4. A general category of developmental disorders called pervasive developmental disorder include autism, Rett disorder, childhood disintegrative disorder, and Asperger's disorder as listed in DSM-4. These disorders involve noticeable abnormalities in the child's social adjustment. In contrast, other developmental disorders such as mental retardation and learning and communication disorders impair the child's cognitive functioning, but these disorders do not necessarily affect social adjustment of all the childhood disorders listed in DSM-4. The pervasive developmental disorders are the most devastating and the most perplexing. These disorders involve problems in many domains of functioning: language attention, social responsiveness, perception, and motor development. The term pervasive is used because early developmental processes are often so seriously impaired that the child usually requires a special educational setting. Objectives. At the end of this lecture, you should be able to 1. Learn about developmental disorders. 2. Discuss pervasive developmental disorders. 3. Learn how developmental disorders affect children. And 4. Identify the various types of developmental disorders. Pre-test. 1. Mention the essential feature of developmental disorders. 2. Mention why the term pervasive is used. 3. List the pervasive developmental disorders. 4. List the other developmental disorders. 5. When is course of developmental disorders termed to be chronic? Content. Autism. Autism is a pervasive developmental disorder whose symptoms are first observed very early in life, usually in infancy. Autistic disorder is also called autism. The pattern was first identified by the American psychiatrist named Leo Kanner in 1943. Children with this disorder are extremely unresponsive to others, uncommunicative, repetitive, and rigid. Their symptoms appear early in life, before 3 years of age. Autism affects 5 of every 10,000 children. Fierce, 2003, APA 2000. About 80% of children with autism are boys. As many as 90% of children with autism remain severely disabled into adulthood and are unable to lead independent lives. APA 2000. The highest functioning adults in autism typically have problems in social interacting and communication and have restricted activities and interests. APA 2000, 1994. Several other disorders are similar to autism but differ to some degree in symptoms or time of consent. These different disorders are categorized as pervasive developmental disorders, but most clinicians refer to them in general as autism. The individual's lack of responsiveness, including extreme aloofness and lack of interest in other people, has long been considered the central feature of autism. Sufferers sometimes have language or communication problems in the forms of echolalia, delayed echolalia, and pronominal reversal. Autism is also marked by limited imaginative play and very repetitive and rigid behavior. Affected children may be unable to play in a varied, spontaneous way to include others in their play. The motor movement of people with this disorder may also be unusual. Characteristics. One main feature of autism is that the child's ability to respond to others does not develop normally within the first 3 years of life. They lack interest in people and do not respond to them. They fail to develop normal attachments to adults who care for them. In infancy, these tendencies are reflected in the failure to cuddle, lack of eye contact, or even aversion to physical affection. These children may fail to develop language, and if language is acquired, it is usually abnormal. It might be characterized by echolalia, the tendency to repeat or echo precisely what one has just heard, and echopraxia, the tendency to repeat the action of others. These children respond negatively to change in their routines or in their environment. Causes of autism. A variety of explanations has been offered for autism. Recent work in the psychological and biological fields has pursued clinical theories that cognitive limitations and abnormalities are the primary causes of autism. Leo Kanner, 1943, a child psychiatrist, was the first to recognize this disorder as a distinct syndrome. A significant proportion of children with autism have IQs in the range of mental retardation. Psychodynamic and behavioral theorists came up with possible psychological causes of autism by examining parental traits. The parents of children with autism seem to be introverted, distant, intellectual, and meticulous. Bettelheim, 1967. They were described as creating an environment of emotional refrigeration, and many clinicians refer to the refrigerator models of these children. It is assumed that the parents' behavioral tendencies were reflected in their offspring. Increase in attention has also been directed to the biological origins of the disorders. Repin and Katzin, 1988. A biological basis to autism is that children with the disorder tend to have seizures. Another biological cause is neurotransmission. When the neurotransmitter activity is abnormal, the brain is unable to pass message efficiently from one neuron to another. This could produce the behavioral and cognitive abnormalities observed in children with autism. Treatment. Behavioral techniques may treat specific disorder caused by autism. A variety of medications are used in treatment of autism. They are prescribed for limited periods of time to treat specific symptoms rather than the entire syndrome. Treatment can help people with autism adapt better to their environment, although no treatment yet known totally reverse the autistic pattern. Behavioral therapies, communication training, parent training, and community integration are being used in treatment of autism. Mental retardation. Mental retardation refers to the substantial limitations in present functioning, AAMR, American Association of Mental Retardation. It is characterized by significantly sub-average intellectual functioning existing concurrently with related limitations in two or more of the following applicable adaptive skill areas: communication, self-care, home living, social skills, community use, self-direction, health and safety, functional academics, leisure, and work. Mental retardation manifests before the age of 18. This definition has been incorporated into DSM-4 as criteria for diagnosing mental retardation. It is often present in children with autism and schizophrenia, according to DSM-4. Mental retardation has 1% prevalence rate. Despite its prevalence, it is however a controversial disorder and it is often difficult to diagnose. In part, the difficulty arises from the stereotypes that people have about mental retardation, but in a larger measure, the difficulty occurs because the notion of intelligence is at the heart of mental retardation, and intelligence is very difficult to define. Gold, 1981. Kamen, 1974. What has been clearly established, however, is that there are more males than females suffering from the disorder. In recent years, the less stigmatizing term developmental disability has become synonymous with mental retardation in clinical settings. Fairs, 2003. Approximately 1 of every 100 persons receives this diagnosis. APA 2000. Around 3/5 of them are male and vast majority are considered mildly retarded. According to DSM-4, people should receive a diagnosis of mental retardation when they display general intellectual functioning that is well below the average in combination with poor adaptive behavior, APA 2000, 1994. That is, in addition to having a low IQ, a score of 70 or below, a person with mental retardant may have great difficulty in areas such as communication, home, living self-direction, or safety. APA 2000, 1994. The symptoms must also appear before the age of 18. Characteristics of mental retardation. The most consistent sign of mental retardation is that the person learns very slowly. Other areas of difficulty are attention, short-term memory planning, and language. These who are institutionalized with mental retardation are particularly likely to have this limitation. DSM-4 describes 4 levels of mental retardation: mild, IQ 50 to 70, moderate, IQ 35 to 49, severe, IQ 20 to 34, and profound, IQ below 20. Mild retardation. About 85 of all people with mental retardation fall into category of mild retardant, IQ 50 to 70, APA 2000. They are sometimes called educable retarded because they can benefit from schooling and can support themselves as adults. Still, they typically need assistance when they are under stress. Their jobs tend to be skilled or semi-skilled. Mild mental retardation is not usually recognized until a child enters school and is assessed there. The intellectual performance of individuals in this category often seems to improve with age. Some even leave the label behind when they leave school, and they go on to function well in the community. Research has linked mild mental retardation mainly to socio-cultural and psychological causes, particularly poor and dull environment, inadequate parent-child interaction, and insufficient learning experiences during a child's early years. Some biological factors also may be causative. Studies suggest, for example, that a mother's moderate drinking, drug use, or malnourishment during pregnancy may lower a child's intellectual potential. Similarly, malnourishment during a child's early years may halt his or her intellectual development, although this effect can be reversed at least partly if a child's diet is improved before too much time goes by. Bareff and Olin, 1999. Moderate retardation. Approximately 10% of persons with mental retardation function at a level of moderate retardation. They can learn to care for themselves and can benefit from vocational training, and many work in unskilled or semi-skilled jobs, usually under supervision. Most persons with moderate retardation also function well in the community if they have supervision. APA 2000, 1994. Approximately 10% of children in this category make up those with mental retardation. Like other children, they are able to learn, to talk, and communicate during the preschool period. But unlike other children, those with moderate mental retardation have difficulty learning social conventions. During the school age period, they can profit from training in social and occupational skills, but they are unlikely to go beyond the second grade levels in academic subjects. Physically, they may be clumsy and occasionally they may suffer from poor motor coordination. Severe mental retardation. Before they are 5, those with severe mental retardation show poor mental development. They develop little or no communicative speech. At special schools, they may learn to talk and can be trained in elementary hygiene. Generally, they are unable to profit from vocational training, though as adults, they may be able to perform simple, unskilled job tasks under supervision. Profound mental retardation. Children in this category are severely handicapped in adaptive behaviors, and they are unable to master the simplest motor tasks during the preschool years. During the school years, some development in motor skills may occur, and a child may respond in a limited way to training in self-care. Severe physical deformity, central nervous system difficulties, and retarded growth are not uncommon. Health and resistance to disease are poor and life expectancy is shorter than normal. These children require custodial care. Causes of mental retardation. Mental retardation may result from chromosomal disorders, prenatal exposure to certain drugs, infections, complications during labor and delivery, postnatal physical trauma to the brain, metabolism or nutrition problems, brain disease, and psychosocial disadvantages, including deprivation, abuse, and neglect. Genetic causes include single gene defects such as Fragile X syndrome and chromosomal disorders such as Down syndrome. Metabolic disorders such as in PICU, phenylketonuria fragile, and syndrome is caused when the tip of X chromosome breaks off. The syndrome is characterized by severe to profound mental retardation, autistic behavior, and speech defects. In addition, males with Fragile X syndrome have large ears, long faces, and enlarged testes. Down syndrome, sometimes referred to as trisomy 21, involves an abnormal number of chromosomes or changes in the structure of a chromosome. The most common form of Down syndrome is not inherited. It occurs at conception and immediately it affects the development of the fetus. It arises because there are 47 chromosomes rather than the usual 46 in the cell is of the children born with the disorder. There is an extra chromosome 21. Down syndrome children have a characteristic facial appearance that usually include white sets, slanted eyes, physical anomalies, especially heart malformations. It is possible to detect chromosomal problems through amniocentesis, a test that is administered to the mother after the 13th week of pregnancy. In this procedure, a small amount of the amniotic fluid, the fluid that surrounds the fetus, is drawn off and examined for the presence of abnormal chromosomes. Environment appears to play an important role in the development of intelligence. The prenatal environment to which the fetus is exposed can have a profound effect on intellectual development. High blood pressure or diabetes in the mother can interfere with fetal brain development. Similarly, infectious diseases and drugs the mother takes can affect fetal development. Low birth weight, premature births, accidental falls, or physical abuse can also cause brain damage and mental retardation. The treatment of mentally retarded children has greatly changed in modern times. In the past, many children with mental retardation were placed in institutionally aged setting. Today, in the Western world, young children with severe retardation are now educated in regional facilities that offers a broad range of educational programs to prepare them for independent living. Early intervention program can provide specialized teaching and other services for infants, toddlers, and preschool children. Some individuals diagnosed with mild mental retardation as children may gradually develop new skills through early intervention and educational services. Children with mental retardation also benefit from help with acquiring social skills that enable them to interact more easily with people in school and community settings. Rett disorder. Rett disorder is distinguished from autism because the disorder shows a different developmental course and patterns of symptoms. Rett disorder typically has its onset between 5 and 48 months of age. Although the age of onset may range from birth to 4 years of age as described by DSM-4. It is a rare disorder with a prevalence estimate of 1 in 10,000. Unlike the other progressive developmental disorder, Rett disorder only occurs in females. At first, the child's physical emotional development is normal. When the disorder does begin to manifest itself, the child shows a slowing down in head growth and a decline in motor and communication skills. She then begins to withdraw from social interaction and rigidly adheres to non-functional routines or rituals. She also starts manifesting stereotypic and repetitive hand or finger movements or whole body movements. Most children with Rett disorder suffer from mental retardation. Unfortunately, Rett disorder is usually persistent and progressive. Studies have discovered that Rett syndrome is caused by mutations in a specific gene on the X chromosome. Childhood disintegrative disorders. In this type of disorder, development is within the normal range at least until the child reaches 2 years. The child begins by showing a loss of skill in at least 2 of 3 areas: language, social, and motor. The symptoms are very similar to those shown by autistic children. This disorder occurs more often in males than in females. The cause of the disorder is unknown, but researchers believe it probably involves some abnormality in the early development of the nervous system. The treatment is the same as those for autism, which are intensive behavior therapy, educational program, and in some cases medication. Asperger's disorder. Asperger's disorder has latest onset. Usually, it is not detected until preschool period or later. The estimated prevalence for Asperger's disorder is 1 to 26% of the population. It is associated with less severe deficits. The primary symptom is impairment in social interaction. It is often accompanied by repetitive patterns of behavior and limited interest. When interacting with others, most individuals with Asperger's disorder fail to make eye contact and their facial expression rarely change. Their body posture and gestures seem almost mechanized. They have few friends and express little interest in recreational activities and humor. Like autism, it is more common in males than females. Surprisingly, some children who suffer from Asperger's disorder are unusually gifted in certain areas. Case study. Samuel was diagnosed as having Asperger's syndrome when he was 10 years old. It was viewed as very unusual by adults and peers. Sam went on to complete his high school education with the help of a tutor. He then got a job packaging groceries at a local supermarket. He has now worked there for over 10 years. He is the most reliable employee at the store. Nonetheless, Sam has very obvious signs of Asperger's disorder. He never makes eye contact, and he greets everyone with the same phrase in the same pitch tone of voice. As patrons enter the store, he says, "Welcome today, and I hope you're doing fine." He turns his head towards the person but averts his gaze to the right and shows no facial expression of emotion. As the customer leaves the store, Sam says goodbye and "I hope you come back real soon." Sometimes he repeats this several times, usually in the same high pitch with the same pattern of intonation. Learning disorders. Learning disorders are more common. Take two. Learning disorders are more common than mental retardation. Learning disorders are difficulties that reflect developmental delays, mainly in the areas of language and mathematical skills. Children with learning disorders are considered to be learning disabled. There are 3 main types of learning disorders, and they are reading disorder, mathematics disorder, and disorders of written expression. Individuals with learning disorders are delayed in specific cognitive skills, not in all areas of mental functioning. They do not have the severe social problems that are characterized with those pervasive developmental disorders. Learning disorders also occur frequently in combination with other difficulties. Frequently with other difficulties. Take two. Children progress in their education at different speeds. A certain amount of lagging behind is to be expected of many children some of the time. But when a child is significantly below the expected level as indexed by the child's schooling age and IQ, then the matter is viewed as psychological. A significant problem exists if the child is more than 2 years behind his or her age level. Reading difficulties. Reading disorder has also been referred to as dyslexia. It is the most common of all the learning disorders. It affects about 2% of school-age children. As group poor readers are late in acquiring language, they are poor spellers and are more likely to have a history of reading difficulty in their families. Children with severe reading difficulties at age 10 are at increased risk of other psychological disorders, particularly behavioral disorders. Boys and girls suffer serious reading difficulties. Theories of the causes of reading disorder focus on various aspects of brain development. One dominant view is that dyslexia is caused by a delay in the development of the brain. Another perspective is that there is actually an abnormality in the structure of the brain. In the treatment of dyslexia, a combination of training in reading skills and behavior therapy designed to maintain a child's interest in learning has proven effective for many children with learning disabilities. Many programs for enhancing reading skills are available for use on home computers. There are social implications of serious reading problems. Poor readers who are of average intelligence rarely read books or newspapers. Some fail to graduate from high school. Many children with reading disabilities emerge from the school system handicapped educationally, socially, and economically, and their employment opportunities may be limited. Their self-esteem often suffers. Nevertheless, most of the children with learning disabilities grow up to be highly successful adults. Summary. The essential feature of developmental disorder is in the acquisition of cognitive, language, motor, or social skills. The cause of developmental disorders tend to be chronic when signs of disorder persist into adult life. However, in mild cases, adaptation or full recovery may occur. A general category called pervasive developmental disorder includes autism, Rett disorder, childhood disintegrative disorder, and Asperger's disorder as listed in DSM-4. Other developmental disorders include mental retardation and learning and communication disorders. The symptoms of autism are first observed very early in life, usually in infancy. Leo Kanner, 1943, a child psychiatrist, was the first to recognize this disorder as a distinct syndrome. Mental retardation refers to the substantial limitation in present functioning, AAMR, American Association of Mental Retardation. Approximately 1 out of every 100 people receive this diagnosis, APA 2000. In Rett disorder, at first, the child's physical and emotional development is normal. When the disorder does begin to manifest itself, the child shows a slowing down in head growth and a decline in motor and communication skills. The typical onset of childhood disintegrative disorder is between 3 and 4 years. The primary symptoms of Asperger's syndrome is impairment in social interaction. There are 3 main types of learning disorders, and they are reading disorder, mathematical disorder, and disorder of written expression. Post-test. 1. Are the essential features of developmental disorders. 2. Pervasive developmental disorders include ... and dash. 3. Other developmental disorders include ... and dash. 4. The symptoms of autism are first observed ... 5. Autistic disorder was first identified by ... in 1943. 6. Mental retardation refers to ... 7. There are ... levels of mental retardation. 8. The age of onset of Rett disorder may range from ... to ... years. 9. Asperger's disorder is not distracted until ... period. 10. Learning disorders are difficulties that reflect developmental delays in the areas of ... and skills. End of study session 4. Thank you for listening.